If you want to lose weight, get your blood sugars under control, get your cholesterol levels under control, have good cardiovascular health, and get your insulin levels under control, this supplement might help. We are talking all things berberine and how it can help you to lose weight, control insulin, control blood glucose levels, and even blood pressure. And depending on what form of berberine you take, you can even start to heal gut dysbiosis, so heal your microbiome, or gut infections like Helicobacter pylori. Isn't that interesting? We're going to talk about how berberine is nature's metformin. We'll talk about how much you need to take in order to see results. We'll talk about what results you can expect. We'll talk about what form of berberine you need to take depending on what it is that you want to do with it and what results you're after. And of course, we'll talk about safety considerations and who should absolutely not take berberine, and so much more. If you're interested in berberine for weight loss or blood sugar control, you might be interested in my free ebook. I will put the link in the description. It is an ebook for weight loss on GLP-1 medications or not. Berberine is one of the more fascinating supplements because it's actually got robust science behind it. There's now quite a lot of science about berberine, and surprisingly, it works in exactly the same pathway in the body as metformin. So because of this, it is possible to use berberine in the correct form if you are pre-diabetic and you're not yet diagnosed as diabetic, so you're not yet on metformin, but you want to reduce your risk of having to go on metformin for diabetes later. So how exactly does berberine work? This is the most important mechanism and one of the most studied mechanisms of berberine. It works in a pathway called the AMPK pathway. AMPK is an enzyme, and it's known as the master metabolic regulator in our body. AMPK is actually triggered from fasting or intense exercise. Berberine activates the same switch, which is why it's sometimes compared to metformin, or sometimes it's even called nature's Ozempic. But I'll talk about why that is in a few minutes. So AMPK, or berberine and metformin, do a few really interesting things in our body. It pulls glucose into the muscle cells, so out of the blood and into the muscle cells, and in that way, it can decrease your blood glucose levels. It also decreases the amount of sugar that our liver produces, so in other words, the glycogen that our liver makes, and it stimulates better signaling for insulin. So this means that berberine can actually give you better insulin sensitivity. So if you are pre-diabetic and your blood sugars are a little bit high, but you're not yet diagnosed as type 2 diabetic, berberine could actually help to get your insulin under control, because it's the insulin that's the problem. It's not so much the blood sugars. The blood sugars are a consequence of having insulin resistance. It also helps your body to oxidize fatty acids. That means more fat burning, but it doesn't stop there. It actually down-regulates fat storage signals. So not only can it help you burn more fat, probably as a consequence of the insulin and blood sugar, but also it decreases the amount of fat storage happening as well. So here's another interesting thing. Depending on the form of berberine that you take, which I'll talk about in a second, it does modify the gut microbiome. So that's all the good and bad bacteria that we have in our gut. Berberine is traditionally very poorly absorbed, and that's why you need to decide what it is that you're trying to do with berberine and decide which form of berberine you're going to get. Because if you're just taking a standard berberine and you're hoping to get the blood sugar results, you're not going to absorb most of it. You'll only absorb 1 to 3% of the total berberine that you take, and that's not a dose that is conducive to bettering insulin levels or blood sugar. So here's another interesting thing that it does. It helps to lower LDL cholesterol, and it helps to increase HDL cholesterol. So LDL cholesterol is referred to as the bad cholesterol, and HDL cholesterol is referred to as the healthy cholesterol, which is easy to remember because if you just think H for healthy and H for HDL, it stands for high-density lipoproteins. So berberine has historically been used in traditional Chinese medicine to treat gut bacterial infections because it's very good at killing bacteria. and specifically pathogenic bacteria, which are the bad bacteria that we have in our gut. These pathogenic bacteria have all sorts of consequences, one of them being that they do mess with your cholesterol levels and heart health and everything else. We call that the heart-gut axis. And the other thing that it can help with as well is candida, which is a yeast type infection, and also another bacteria which normally occurs in the stomach, which is called Helicobacter pylori, or you could call it H. pylori. You've probably heard of that one. But berberine is known to reduce the amount of H. pylori in the stomach. And there's some much less well-developed studies, but they're still ongoing. Berberine has the ability to cross the blood-brain barrier, which is interesting, and it may have neuroprotective effects as well. And it may modestly reduce blood pressure, and it's acting on the smooth muscle tissue, which is found in our blood vessels. I've been taking berberine for quite a while now, and I actually use berberine and NAD together, and I think they work beautifully together. I started taking berberine to get my blood sugars under control. That was long before I started the GLP-1, and I feel like it did help. And at the same time, I started taking NAD. So the two together are wonderful for giving you energy. And I think the reason for that is because NAD works on our metabolism to give us energy. I did a video on that, which I'll put here so you can watch that later if you're interested. And berberine with NAD, because it's leveling out your blood sugars and keeping your insulin under control, in an indirect way, you have more energy. So you know how, like, if our blood sugars are up and down all day long, we get the dip, the energy dip. You don't get that when you're taking berberine, and especially if you have a diet that works with berberine, you don't get that. So you end up with lots and lots of energy to get through the entire day without feeling like you need to crash at 3 p.m. Anyway, so I have found a berberine which is the right form, which I'm going to talk about next, and it is highly absorbable for supporting things like blood cholesterol levels, blood sugar levels, insulin sensitivity, hypertension if you've got high blood pressure. If you're interested, I'll pop the link in the description. You can have a look. This particular brand is very good quality because of the form, and it's also on discount for 25% off, which I love. So what form of berberine should you be taking? If you want to treat dysbiosis, candida, or H. pylori, any bacterial infections in the digestive system, then you just need the standard berberine. If, on the other hand, you want it for blood glucose control, insulin sensitivity, or weight loss, you need to choose a phytosome. So that's a very similar thing to a liposomal. And that's because you want to absorb much more of it. So if you get a phytosome, you're going to absorb 10 times more than you will from just the standard form of berberine. So the link that I've put in the description is the phytosome form. And there's a few different brands of phytosomes. So the link is for iHerb. You can check out all the different brands. I chose the one that I liked best, and that was based on quality and price because I am a little bit of a tight ass. If you're looking for something to support bacterial infections, you would be looking for berberine hydrochloride. And especially if you feel like you've got leaky gut or something like that, or dysbiosis, like a microbiome dysbiosis. So from that form, you will absorb 1 to 3% of it. So you might get a little tiny bit of an effect on your blood glucose levels as well. So in terms of weight loss, they've actually done some studies, and this is where the nature's Ozempic thing comes from. Berberine does appear to cause small but lasting reductions in body weight, fat percentage, and waist circumference, probably through the combination of improved insulin sensitivity and the effects that it has on fat cell development. So remember, that's reduced. So it inhibits fat storage. And it's probably also attributed to the gut microbiome changes as well, because it's killing off pathogenic bacteria, bad bacteria. So the weight loss that people saw was 2 to 5 pounds over an 8-week period. Now, you have to remember, in these studies, people weren't doing anything else. They were only taking berberine. When I started taking berberine, I also made sure that I had a really low-carb diet. I made sure that I was exercising, but I did actually see a bit of a result, and I can't remember now because I didn't really measure, but I do remember telling my girlfriend that my bra was getting looser And it was probably from the combination of NAD and berberine, because all of a sudden I'd stimulated my metabolism and leveled off my blood sugars. And so I did sort of see a bit of a reduction in weight. Now, of course, this is nothing compared to what you see with a GLP-1. And people do ask me, is it safe to take berberine with a GLP-1? If you're taking quite a high dose of GLP-1, you do need to talk to your doctor, because the GLP-1 is also working to bring down your blood sugars and your insulin. And so because of that, you don't want to double up too much, and you don't want to end up with low blood sugar, because that's very dangerous. So for my purposes, I am taking a very, very low dose of Mounjaro. And so because of that, I have not noticed any interaction. But it's worth talking to either your pharmacist or your doctor about it before you just go and grab berberine if you're on a standard dose of GLP-1. Traditionally, though, berberine is not a weight loss drug, but the metabolic improvements do mean that it's easier to lose weight if you're taking just berberine by itself. So they've done studies on diabetes research as well, where they've found that it does reduce fasting blood glucose levels and post-meal glucose spikes, which is very good, because that's what you get when your insulin's sort of out of control. And it is comparable to metformin. So in other words, people that were on metformin and people that were on berberine got very similar results when it came to measuring fasting blood glucose and post-meal blood glucose spikes. And so those studies found that berberine reduced HbA1c by about 2% over 3 months. So how much do you need to take? You need to take 500 milligrams 2 to 3 times a day. Now, this is the standard protocol. That the recommended way to take this is to take it 15 to 30 minutes before a main meal. You can take up to 1,500 milligrams per day, so 500 milligrams 3 times a day, or maybe 500 milligrams twice a day. Now, having said all of that, that's the standard protocol. If you're taking a Phytosome, now this is important. If you're taking a Phytosome, you are not going to get the classic side effect of having diarrhea. But if you're taking the standard berberine, you might get the standard diarrhea gut upset effect. And that's because it's killing off your bacteria, right? It's very similar to taking an antibiotic. So what I do is I just take mine first thing in the morning. I take it with my NAD at ridiculous o'clock, 4:30 a.m. And that's it. I don't take it before meals or anything like that, purely because I know I won't do it. So I just decided I'll just take it with my multivitamin and my fish oils and everything else I take at the beginning of the day, and that way I know I'm actually taking it. And I think personally, I believe if you're taking a Phytosome form, it doesn't really matter if you're taking it away from meals. If you're taking the hydrochloride form, then you probably do need to take it with meals. Otherwise, you may end up with an upset stomach. And the normal protocol before they started making the Phytosome form, the normal clinical protocol was that you would cycle somebody on for 8 weeks and then you would cycle them off for 4 weeks. And that was to give their gut a chance to recover, because it will mess up your microbiome. So that's another good reason to get a Phytosome, unless you're trying to support a bacterial infection. Okay, let's talk side effects. So there are actually a few side effects to berberine, and especially in the dosage that we've been talking about. So it is best to, of course, consult your doctor if you're on any other medications whatsoever, or if you have pre-existing health conditions. You should be starting low and go slowly with it. But once you build up to a therapeutic dose, most people tolerate berberine quite well if you're taking the Phytosome form. There have been some rare cases where liver enzymes have been elevated, and it's worth checking liver function if you're going to use berberine long-term. If you find this information helpful, please do remember to tap on that like button for me and subscribe if you like more information about health, weight loss, and longevity. And leave a comment. If you're going to try berberine, or if you've already tried berberine, tell me, did you have any side effects? Have you had any medical interactions with it? The more we share with each other, the better everything is. So let's talk about cholesterol and cardiovascular effects as well. Berberine has been shown to reduce LDL cholesterol consistently to the point of 15 to 25%. Isn't that crazy? It has reduced triglycerides to the tune of 25 to 35%, and it has raised HDL, remember that's the healthy cholesterol, moderately. These are all statistically significant numbers which means that berberine could really help with high cholesterol levels if you are not yet on medications. So let's talk medication interactions. There's one of them, obviously, is metformin. If you are taking metformin, you don't need to take berberine because they're doing exactly the same thing in that AMPK pathway that we discussed earlier. Insulin, definitely should be careful with berberine, and I would say don't take it unless you're going to talk to your doctor. And then, of course, the GLP-1 medications. If you're on a standard dose of GLP-1, you need to talk to your doctor about that as well. Statin medications, also anticoagulant medications, so warfarin and things of the like. Antibiotics, if you took berberine with antibiotics, you're going to have double the effect in your gut if you're just taking the standard berberine. And then a couple of others, antidepressants, beta blockers, and seizure medication as well. And of course, if you're pregnant and breastfeeding, just don't take anything. If you're interested in learning more about controlling insulin and blood sugar levels, I did an experiment on myself where I wore a CGM for a couple of weeks and then documented the whole thing. And because I'm a nutritionist, I also put a lot of information in that video about controlling blood sugars as well. And the best part of that video, I think, is me showing you what happened to my blood sugars when I ate some sweet popcorn. Anyway, if you're interested in learning about blood sugars, getting them under control, or if you're considering taking berberine for weight loss, that would be a really good video to watch, because if you combine the information in that video with the berberine, you will get the very best results. So I'll pop that here for you if you want to watch that next. So I'll see you in there.
Smarternuthub Nutrition, DLP done well.